Can a woman be able to know that they are in their fertile days? Yes, you can actually. In this video, we are going to share the signs of fertile days. And so what can I see, or what can a woman see? And you're able to tell that now I'm in my fertile days, and if I had sexual intercourse, I can become pregnant. Number one is what we call cervical mucus. So what happens to my cervical mucus? So during the time when you're in your fertile days, what we're calling the fertile window, your cervical mucus, this is the mucus that comes from your cervix. Mucus secreted, mucus from your cervix. So what happens is that when you're in your fertile days, it increases a bit in terms of quantity, and then it becomes a bit clear, and then it becomes thick. So if you see that actually your discharge is not abnormal per se, however it's more clear, it is thick, it is, sometimes we call it egg white mucus, or egg white like. Looks like the way you see the color of an egg. If you know the eggs, like in some countries, like for example in our country, Uganda, like the shell is white. So the egg white like mucus will tell you most times you are in your fertile days. So if you wanted to become pregnant and you have this sign, that alone can inform you that now if you had sex, you can actually, sexual intercourse actually can go ahead and become pregnant. Then number two, slight increase in the basal body temperature. So what happens is that you'll have a rise in your body temperature. For example, if in normal days your temperature has been around 36.2 to 36.8, when you're in your fertile days, that a bit changes. So that means we shall have an increase to about maybe 37.5, 37.4, above your basal body temperature. So like if you're one of these educated ladies or women who actually are concerned about their health, and you've been monitoring your body temperature, or by actually just feeling, you may feel that this is not your usual temperature. That for example, you may feel like after running, when you're sweating, that's a bit a high temperature. So even here, even though you don't actually measure your temperature or auxiliary temperature or background temperature, but you will have that feeling that this temperature actually is above my usual temperature. So if that happens, it means you've undergone what we call ovulation. And when you undergo an ovulation, that means the egg that can be fertilized is waiting in your fallopian tube, or what we call the oviduct. And that means you are in your fertile days. Then the other thing, you may feel a bit of pain. For example, this is your stomach, or actually the white man usually calls it the abdomen. So that is your stomach in brief, or your abdomen. So in this abdomen, it has sides. This is, if you're facing me, will be your right, and this will be your left. So when ovulation occurs, you may feel pain on one side where the egg has come out. For example, you can feel pain in what we call the right iliac fossa. So when you feel pain this side, that means the ovary on the right side has released an egg. So in that, the other side will be, you may feel a mild pelvic or abdominal pain, which is usually one-sided. It can occur on the left or it can occur on the right. Then the most easy one actually to note is you'll have increased libido. You'll have increased libido. What is libido? This is a feeling or a desire to have intercourse. This is the time for the gents. You've been talking about, you've been trying to sweet talk this lady into a relationship, and she has been saying no. When this time comes, she will give you a phone call. She will ask you out instead of you asking her. So when you have increase in libido, it's another sign that you are in your fertile days. Then lastly, for people who can access what we call the ovulation kits, if you do an ovulation test, you will have an ovulation, a positive ovulation test. I call it a positive ovulation test. Or if you are able to measure some hormones, for example, the luteinizing hormones, you will have a surge of luteinizing hormone, or the luteinizing hormone will be very high. It will be at the ceiling at that time. So in summary, we have 5 signs that someone can actually consider or look into to make sure or to know that they're in their fertile days. And we've said cervical mucus, increase in body temperature from the basal temperature, mild pelvic pain, which can be left or right depending on where the egg has come from. Then increased libido. This is desire to have intercourse with your partner. Then finally, if you do an ovulation test, it will be positive. Thank you very much. This concludes the video about signs of fertile days. I remain Dr. Siraj, the women specialist. And if this is your first time to watch our videos, I again actually request you to subscribe and then follow us for weekly updates. Thank you once again.